Thank you, John. Well, like Robert, I also practice in occupational medicine, but my practice also extends into general practice, which was my initial training. And I suppose I would be very familiar with the challenges in general practice of dealing with sickness certification and rehabilitation to work. And I would see my sort of training in occupational medicine as an extra benefit in helping my patients get back to work. And I can understand, I suppose, the different perspectives people might have on illness or disability or ability to work. Knowing it from the patient perspective, obviously, and maybe from the employer's perspective about whether somebody's fit for work or not. So it is a great challenge, I suppose the whole sickness certification piece in terms of, I suppose from a GP's perspective, you're a patient advocate, people come in, maybe they expect a certificate, at some level designating whether somebody is giving them a certificate is saying whether they're fit or not fit for work. And of course, fitness for work, to assess that, you really have to have some good idea of what they actually do, as well as obviously their medical illness as well. So, GPs may not have access to that kind of information. And I mean, I suppose occupational health training for GPs mightn't have been as good as it could have been in the past. And clear guidelines for sickness certification, they aren't really there. So it's quite a difficult call to make. And, GPs will often, I suppose, in their role as patient advocate, be inclined to believe and follow their patients in terms of, I suppose, the information they're given about work, or whether something's work-related, or whether somebody is able to work or not. So the challenge then is to create, I suppose, what we're working on is a quick reference guide for general practitioners and indeed specialists across all hospital-based specialities, because general practitioners aren't the only people that write sickness certificates or assess fitness for work. In terms of the broader question of what kind of issues should be on a sickness certificate, what kind of information might be reasonable to not to put on a sickness certificate. After all, our medical information is private, and we're all, entitled to total confidentiality in relation to our medical information. And how do we get around those issues when people are looking for information, looking for different pieces of data in order to make decisions? As most people here are aware, there's two aspects to sickness certification. One is the note that's given to an employer from day one. So that is, most employers or HR departments would expect a note to say someone's fit or unfit for work. And then after 3 days of absence, you have your social welfare certification. So the two slightly different entities, and really what I'm focusing on with the ICGP is on the first note, which is the note that's given to employers. What kind of information should be on that? Could we change it slightly to introduce a more rehabilitative component to it? Because I know from personal experience dealing with patients how difficult it is to broach that issue when somebody's expecting a certificate. You challenge them, you might offend them. It might upset that sensitive doctor-patient relationship where people might think you're not believing them and you're not taking their word for it. So there has to be some prompts in there, maybe in the form, to say, could we agree a target return to work date, for example, sometime in the future? Are there any other therapies which could be provided even by your employer, for example, that might aid your rehabilitation to work? Have you considered maybe modifications or restrictions or temporary reduction in hours or whatever that might help somebody to overcome that psychological barrier oftentimes in getting back to work? And I suppose it does tail with the Fit Note in the UK, which was obviously a very sensible and logical innovation, and we've watched that very closely. We wouldn't be looking to mirror that, but we'd certainly look at the evidence and how it's been applied over there. Obviously a slightly different system to ours. So to some extent it's about the wider discussion about sickness certification and what's appropriate and what's not, and then maybe about the finer detail in terms of what the process should be, and could we produce, for example, a recommended certificate that would encourage I suppose what we might regard to be the best evidence-based information to be on there to get the best outcomes for our patients.
Thank you very much indeed, John.